This podcast series is made possible thanks to the generous support of the Cooperative of American Physicians. Physician-founded and physician-governed, CAP provides superior medical malpractice coverage and solutions to more than 12,500 California physicians and helps them realize professional and personal success. Upon joining CAP, members receive risk management services, claims support, and a dedicated in-house defense firm, practice management resources, and so much more. CAP has been a long-standing premier LACMA partner and continues to support our members every day. To learn more, visit capphysicians.com. That's capphysicians.com.
Thank you, Senator, for meeting us today. This is a Clear as Mud podcast. Can you tell us a little bit about your district?
Well, the first thing is I hate the term district. District's a Soviet term. It's a politician's term. That's my son calling me. We represent communities, and people live in communities and live in districts. Districts are politician lines. They're artificial lines in the air that we politicians draw. And I represent the San Fernando Valley. I represented that when I was Speaker of the Assembly. I represent it now as just outgoing Majority Leader of the California Senate. And it's more than half Latino. It's working class folks. It's part of the American dream. It's got the people on the hill who've made it and the people in the flats who are trying to make it. It's got all kinds of people from all backgrounds. It started out in the odd history of Los Angeles as being a place that was a bedroom community, and it's morphed into just an extraordinarily diverse community that really reflects the passions and dreams of what makes this place a great place. It's a pretty cool place to represent.
Wow, I really appreciate you saying that. I think we should change the lingo. So can you share with us how the pandemic changed your view of healthcare?
Yeah, it's changed my views on so many things. I've been in government for a long time. I was here when Truck was running in the building, and I was here during the Al Gore deal with the elections, and I've been here through the energy crisis where all the lights were going off in the hospitals and all the crazy things. But the pandemic was different in terms of it had a lot of different aspects. It had great aspects of community coming together, of so many of us coming in, coming up with creative ways to bring PPP to folks that we couldn't get at the time, because who stocked that kind of PPP? Heard stories of people wearing plastic bags, nurses and doctors, to try to protect themselves and not having masks. Horrible stories. And to see the energy and passion of people from the community volunteering and donating, it was kind of a great aspect of it. To see what happened with respect to coming up with the vaccines, so quickly. I've been around this a long time, and you see how long it took for the federal government to act, and to act the way they acted so quickly, and for the genius people to come up with the stuff that they did was pretty incredible. The global impact, extraordinary. The impact on people's work and community, the impact on families in terms of people that lost people, the understanding of what essential workers were, and the ability of folks to work at home. Me in politics, I work in a business that's personal. Meet people, talk to them, and my life became Zooms. Who knew what a Zoom was before the pandemic? It was extraordinary. I think it's going to change the future of work. I think it's going to change. In terms of medicine, a few more people signed up in terms of what happens in terms of healthcare. I think it's going to have a big impact on healthcare. I think it's going to inform us about future risks for other pandemics, because all of a sudden, 1918, we saw the Spanish flu, but no one around was around 1918. And so I think it's going to have a long-term impact in so many extraordinary ways in society, in people, in medicine, in home health care, in how seniors are taken care of and housed. I mean, it literally hits the whole array of healthcare, from skilled nursing facilities, the impacts of all of those folks, and how the virus spread with respect to those people, and liability issues, and how we take care of folks. I mean, my mind races, just as you can kind of feel it in listening to this question, of all of the kinds of issues and impacts that this has had. And hopefully it inspires more people to go into the field of medicine and take care of folks.
Wow, that response invokes a feeling of unity and disruption almost at the same time.
That's right. It's the best of times, it's the worst of times. It's part of the human condition. We see this all the time. I'm a student of history, and you see it in so many contexts. And so I think the genius of us in public service is to try to understand the architecture of the future, to figure out and to pull out those elements of what those changes are, and to be able to restructure. Change is very hard to do. And so now with this pandemic and the impact on so many things, how communities are organized, how healthcare is organized, how we see work, I see essential workers. Our jobs take advantage of that, the best of it, to take advantage of it and to learn from it and to invent the future in a better way, rather than looking backwards and saying, oh, God, it was horrible. That's what we should do. That's what leadership's about. That's what I try to do.
Wow. Well, we appreciate all your efforts, Senator Hertzberg. Last question: what are your looking toward the future? What are your healthcare priorities, and how can we help support you in that?
Stay alive, man. Stay alive. I'm getting old, so I'm getting old, man. It's like no one wants to get old. It's like you start to creak a little bit. Your knees start to hurt. You can't bounce as far. I'm a road warrior. I just went to go look at some environmental project in Reykjavik. I went there for 2 days. I'm like, I wasn't tired. I just work hard. I start at 4 a.m. I do what I got to do. But in terms of the healthcare issue, it's really about, I think, making sure, you've got people living in homes that are poor and they've got more people, so pandemics and germs can spread. You've got to think about that. You got to think about, I just think it's such an opportunity for us to engage in a bigger picture think. And also, I always look at the community. I look at, the larger issues of the country and the state, and then I look at internationally of how you can impact, because you have this disparate application of medicine, And so I look at things in such an interesting way, in my view anyway. I think it's interesting, like solar-powered refrigerators to maintain medicine in countries that don't have can't maintain medicine that needs to be cold. The ability of telemedicine, where you doctors can go and perform all sorts of great things all around the world and use your skill sets in new ways. I just think the opportunities in medicine are nothing less than extraordinary. The challenges are costs. The challenges are the management of the system, which is just a muck of muck. You want to talk about your podcast called Clear as Mud? Go take a look at how the medical system, the financial side of the system, is regulated and stuff. It's that mud you can't see through. It's just, you can't move through it. It's so bad. I'd love to be able to fix that. I'd love to be able to figure out a way to make it work better. That to me would be wonderful.
Wow. Well, we appreciate your passion, your energy, and your time, everything you're doing. Thank you so much for your time, Senator Hertzberg.
Well, you guys, go save people, man. Let me tell you something. Your responsibility to the next generation is to figure out, fix it, and make it better for the next generation. I have worked my heart out to do everything I can to make it better for you guys, and now you guys got to take it to the next level, and don't screw it up.
We'll do our best.
Thank you.
Thank you again.